Hi guys, hope you're doing well. MSRA is coming up very soon and lots of people are contacting me asking about the clinical paper, what it's all about, how to revise, what to prepare, what's going to be tested. So I thought I'd do a really quick video on the MSRA clinical part of the paper. Obviously MSRA is an assessment being used for multiple different recruitments in terms of speciality, so general practice, psychiatry, anesthetics, radiology. There's a huge list of different ones and we've got a blog which covers everything about the MSRA in detail, but this is about what is going to come up in the clinical paper. There are two papers, clinical and SJT, and a lot of people put a lot of worry and time into the SJT paper, but neglect the clinical paper and then realize with a couple of weeks ago, gosh, there's actually quite a lot of clinical stuff that I don't know. So it's important to get a plan in place and understand what you need to know from a clinical point of view. So clinical paper, 97 questions in 75 minutes. So you've got to be going at quite a high pace. It's not just testing pure knowledge. It'll assume that you've got a certain level of knowledge. It's about your application of knowledge in certain areas, which we'll talk about in a second. There are two main types of question, your SBA and your EMQ. So SBA is single best answer. So you get a series of 5 different answers and you choose the single best one. And EMQ, extended matching question, where you get a much longer list of answers that may relate to 2 or 3 different questions. So slightly different in terms of how you're assessed. So I'm going to talk about the main categories that the GPNRO blueprint says you need to know, the categories that the questions will come from in the clinical paper. We'll talk about the different things that are going to be assessed from those categories. And I'll just remind you how to get 10% off any of our clinical teaching courses. We've got an online course, audio courses, mock exams, and flashcards. The code Aurora Video 10, remember, will get you 10% off those. And I'll tell you about all those things and how they can help you boost your score in the clinical paper. Right, let's start with the 12 different categories that questions can come up from. So if you're trying to base your preparation in terms of going through subject-wise, in terms of day 1 this, day 2 this, day 3 this, these are the 12 things, actually more than 12 because there's 2 or 3 in some of them that you need to focus on in terms of preparation. Number 1, cardiovascular. Number 2, derm, ENT and eyes, ophthalmology. Number 3, endocrine and metabolic. Number 4, gastroenterology and nutrition. Number 5 has got 5 things in itself: infectious disease, hematology, immunology, allergy, and genetics. So just that one section in itself has got 5 big topics: MSK, musculoskeletal, pediatrics, pharmacology and therapeutics, psychiatry and neurology. 2 huge things in one there. It's not really one section. Renal and urology, reproductive, so women's health, etc., and respiratory. Now that's basically all of medicine, isn't it? There's not much you cannot put in one of these categories. Yes, there's 12 and it doesn't seem that bad, but actually when you break it apart, there's a lot of information that you've got to know when it comes to the clinical paper. And it's amazing how many times after MSRA, people say, gosh, that was a lot tougher than I thought, because they're focused so much on SJT, which is an area that people often struggle with. We've got other videos on SJTs if that is your worry. 5 key domains. So from these 12 different clinical areas, or more than 12, I should say, there are 5 possible areas that can be tested in this paper. Number 1, investigation. So what kind of test might you arrange to try and get closer to a diagnosis, for example? Diagnosis itself, so what is the most likely condition that you're going to get when you get a series of symptoms? Emergency management, so what to do there and then. It's testing, is your knowledge up there? Can you apply your knowledge in terms of dealing with emergency situations? Prescribing, so things like side effects and drugs and medications. And also management, but in a non-clinical way. So self-help advice, non-clinical, non-pharma management options that might be available for a particular question. So investigations, diagnosis, emergency, prescribing, and management. So if you're trying to go through these different sections, you've got to focus your work on not just trying to learn everything, but thinking, how do the things I'm learning fit into one of these 5 categories? So lots and lots to learn when it comes to the clinical part of MSRA. Please don't neglect it. How can we help you? Remember, there's a code, Aurora Video 10, gets you 10% off any of these things I want to talk about right now. And we have a variety of different learning or teaching things, I should say, to help you learn in the way that suits you best. These all come in what we call the MSRA Gold Pass package, which is basically a discounted bundle which contains everything we have for MSRA. So you can use the code on that, Aurora Video 10, or you can get one of these individual things depending on how you learn best. So the first and the most, I'd say the most coverage that you're going to get in terms of these 12 areas is the MSRA Clinical Grammar online course. So this is an online course that you can get for 1 month, 3 months, 6 months, or 12 months, depending on when your MSRA is. And we basically have broken these 12 things down into chapters, and we teach you all of these kind of things that you need to know to cover the knowledge that allows you to apply that stuff when it comes to exams. So that's the MSRA Clinical Grammar online course. You can watch it, pause it, go back to it as many times as you like in that time period, and it's our longest, most detailed clinical course for MSRA. Number 2, we have the MSRA Clinical Audio. I'm just going to push it across. The MSRA Clinical Audiobook course. So this is quite a popular course that people use if you're trying to buy time. You guys are busy junior doctors, you're working probably on-call shifts, long shifts at the moment. You probably come home very tired, and sometimes the last thing you want to do is open up a question bank or start looking at a course. So the audiobooks are designed to download to your phone, and you can listen to them when you're commuting, when you're traveling, when you're shopping, etc. And it buys you time. And again, it's broken down into these 12 topics and focuses on these 5 areas. The third thing that might be useful from the clinical paper point of view is our MSRA clinical mock exams. We have focused detailed mock exams based on the same style that you're going to get in the exam. So 97 questions to 75 minutes, based on the 2 main types of questions that you're going to get. And they're quite challenging, but they test you not just from a knowledge point of view, not just from an application knowledge point of view, but they build on the stuff that we teach you in the online course and in the audio course. And the fourth thing that is quite popular are our flashcards, our clinical high yield flashcards, all the guidelines, all the treatments, all the diagnoses that you need to know in 150 cards that you can look at wherever you are, whenever you have in the day. So all these 4 things come as part of our MSRA Gold Pass package, which is our most popular bundle when it comes to MSRA. But on top of those things, it also contains our SJT material, so SJT audiobooks and SJT mock exams as well. But one thing to remember when it comes to MSRA, do not please neglect the clinical part of the paper. It counts for a huge amount when it comes to your chances of getting into the rotation and the job and the training post that you want. Don't just focus on SJT. There's a lot of material that you need to cover. Quick recap then: cardiovascular, dermatology, ENT, eyes, endocrine, metabolic, gastronutrition, ID, hematology, immunology, allergy and genetics, musculoskeletal, pediatrics, pharmacology, psychiatry, neurology, renal, urology, reproductive and respiratory. And the 5 things that you've got to think about when you're preparing: investigation, diagnosis, emergency, prescribing and management. Please do not rely just on doing thousands of questions to try and cover all of this stuff. You need some solid background in terms of building knowledge. And as we talked about, the discount Aurora Video 10 will get you 10% off the online clinical course, the audio clinical course, the clinical mock exams, and the clinical flashcards as well. The website is auroramedicaleducation.co.uk. I'm Dr. Amin Arora. I'm a GP now in full-time medical education. My passion is to get you guys through exams like this to get you through the career that you want. Take care. Hashtag Can't Pass Will Pass. Hashtag I went with Aurora.